So today, the Trump administration released its report on making America healthy again. It's lengthy, and it tries to diagnose the main causes of chronic disease in America. It paints a pretty bleak picture of children's health, focusing largely on ultra-processed foods, chemical exposures, lack of physical activity, stress, and excessive use of prescription drugs. And look, health and chronic disease are serious issues, but I think we should all be pretty skeptical that this commission, headed by a crank conspiracy theorist, will come up with the proper prescriptions for these problems. And that's the important part here, right? Because if the Trump administration really cared about making America healthy again, they wouldn't be doing what they're doing. They wouldn't have closed the CDC's Office on Smoking and Health, or halted funding for the Diabetes Prevention Program, or made plans to roll back regulations on forever chemicals in drinking water, or censored leading nutrition scientists, or cut billions of dollars in research funding at the NIH, the largest funder of cancer research. And they definitely wouldn't have supported a bill that will strip healthcare and food access from millions of Americans. Joining me now is Dr. Ashish Jha. He is Dean of the Brown University School of Public Health and the former White House COVID-19 response coordinator. I wanted to, chronic health is obviously a big issue, a serious issue. We all care about our kids' health. But what have you, I don't know if you've had a chance to look at this report, what it outlines and what some of the conclusions are. What do you make of it?
Yeah, well, first of all, Jen, thanks for having me back. Look, starts off by saying our kids are the sickest they've ever been. I think it's worth remembering childhood mortality is the lowest it's ever been in the U.S. history, and that's because of vaccines. We've gotten much better at preventing a lot of infectious illnesses. Now, the report, what it gets right, let's start there. It identifies chronic illness as a problem. It is. It's great to see the secretary join the public health movement. We've been talking about obesity. We've been talking about access to better food. We've been talking about exercise. Those are important things, no question. The problem is then when he gets into prescriptions of what to do, there's really just not much there. And most of his ideas are not based in science. And so he identifies the problem that all of us have been talking about, but without anything that even remotely resembles a solution.
Then the solutions are kind of pivotal here, I would say. He said in his recent hearings, he said on multiple occasions that he did not know if a program had been cut or not, which seems like a pretty pivotal thing for the HHS secretary to know. What do you make of that he seems to be unaware of the decisions that are going on in his own agency?
Yeah, well, that's the other part of this, right? And you allude to this both in your opening statement and now that, look, he identifies chronic disease as a serious problem. We all agree with that. Totally right. But if he actually believed that, he would not be eliminating the Office of Chronic Disease Prevention at the CDC. As you said, he would not be eliminating massive amounts of research on how to prevent obesity and chronic disease in children. Like, there is a huge mismatch between the slogan, the tagline that says chronic disease is a problem, and then gutting all the programs that are actually going to do anything about it. So it's really not clear what the secretary intends because his words don't seem to match his actions.
Well, you're here. I wanted to ask you about vaccines. I mean, you mentioned them as well, and you were the COVID-19 coordinator for the Biden administration. This administration has limited approval for seasonal COVID-19 shots to seniors and high-risk individuals, and the FDA advisory panel split on whether the agency should require updates of COVID vaccines, which opens the door, of course, to the possibility that we won't have updated shots for the fall. Well, first of all, I hope I summarized it correctly, but help us understand what the impact of that could be on people's access for the vaccine and health.
Yeah. Well, first and foremost, Jen, when we made decisions about this, when I was at the White House, first of all, the people at the White House didn't make the decisions. The scientists at the FDA made those decisions, and they based it on data. There is no data on which they are making these decisions. Second, the secretary said he was never going to limit people's access to vaccines. He has just limited people's access to vaccines. If you're under 65, you're not going to be eligible. My view is people over 65 absolutely need to get COVID vaccines. People under 65 should have the option, especially if they have chronic diseases. He is really taking away people's choices. And I really do worry about where this is going. Annual updates of COVID vaccines, like annual updates of flu vaccines, is essential, especially for high-risk people. And whether he's going to continue doing that or not really is unclear at this moment.
Thank you, Dr. Ashish Jha. I always enjoy talking to you. Helps provide a lot of clarity to people out there. Really appreciate it.